Good evening, good morning, good afternoon, everyone, and welcome. Thank you so much for joining us for our Veterinarians Without Borders Women's Month 2026 webinar. My name is Janine Mitchell. I'm the Executive Director of VWB North America, and it's a real pleasure to have you all here with us today. Before we begin, I would like to acknowledge that VWB operates across many traditional territories of Indigenous peoples, and we recognize and respect the lands and communities where we work. Just to talk a little bit about Women's Month, it really is an opportunity for us to advance discussions on gender equality and leadership in various fields. This year's Women's Month theme is Give to Gain. And at VWB, this idea is deeply embedded in how we work. Across all of our programs in Northern Canada, across Africa and Asia, and through our volunteer partnerships, we see every day that progress does not happen in isolation. It really happens through exchange. When women gain access to training, they share that knowledge within households. When volunteers contribute their skills, they also gain new perspectives and insights. And when communities lead, systems become stronger and more sustainable. So today's conversation is really about that exchange, how giving knowledge, time, and leadership leads to meaningful gains for women, for communities, and for animals and public health systems. So just to give you a little bit of an overview of how this webinar is going to work, we're going to begin with 3 short presentations from our panelists. Each speaker will have about 10 minutes to present their insights and experiences. And after that, we're going to move into some short discussion. Hopefully you've got some questions available for us as you're listening to the speakers. And you will have an opportunity to ask those questions directly. So no need to wait for the Q&A section. Please feel free to submit your questions in the Zoom Q&A chat at any time throughout the webinar. And also, if the chat is open, feel free to put your comments in there as we go. So I'm going to hand it over to our first speaker, who's Dr. Trace McKay. She is a veterinarian based in Lions Head, Ontario, with more than 20 years of experience across clinical practice and public health. She's been involved with VWB since its early years, volunteering across programs in Africa, Asia, Northern Canada, and Alaska. Through VWB's Northern Animal Health Initiative, she's supported mobile veterinary clinics and community-based animal health services in remote northern communities, work that is deeply rooted in trust, partnership, and local leadership. Today, Trace will reflect on what it's like to deliver veterinary care in these contexts and what she's learned from working alongside local dog owners, women, community members, and lay vaccinators. So over to you, Trace.
Thanks for that introduction, and good day and good evening, everybody who's joining us. I'm just going to share my screen. Give me 1 second. And we'll get this already started. All right. I can't see you, but I'm going to assume everybody can see this. Okay. So I'm here tonight to talk about what's gained and what you give when you volunteer in the North in Canada, delivering veterinary care in communities that otherwise wouldn't have access to veterinarians for preventive health and sometimes sick animals. I've been involved with the North American Animal Health Initiative now for the past 3 years, and started as a contract worker doing a community needs and assets assessment in Joe Haven, and then returned as a volunteer, and I'm hooked and I can't stop. So I'm going to share with you what I've learned about what can be given and what can be gained on this project in the next 10 minutes. Right. In the North, dogs and people have been together for thousands of years. And while the roles of dogs and the relationship with people has changed over time, they are woven into the cultural identity of the Inuit and First Nations and remain a symbol of resilience. Tonight, I'm just going to share some of my experiences with the NAHI and a little bit about the Community Animal Health Worker Program and what it takes to give access to veterinary care in Canada's North and what can be gained through volunteerism. My first NAHI trip, as I mentioned, was in Joe Haven. And since then, I've been to a few communities and plan to return to Joe Haven again this spring to do a wellness clinic. And it's become a really important part of filling my cup for sure as a volunteer. It's quite rewarding. These are just some images of the relationship of dogs in the time over time from Joe Haven. Wall hangings are a very important art form. And these were hanging in the museum. They're just beautiful images of people and their dog. So, what does it take to be prepared to give as a volunteer in the North? You got to be ready for just about everything. Besides having your appropriate licensing and doing all the onboarding and training, you should try learning as much about the communities you're going to as you can. You're going to be spending time in, and what weather conditions to pack for. The seasons can be very varied. You can have extremely cold weather. You can have like weather hovering around zero. Your daylight hours can be very long, or your daylight hours can be very short. So you have to be prepared for all those things. And you have to pack accordingly, but you've got to pack light, and most importantly, leave a little bit of room so that you can pack some of the amazing arts and crafts that are done in the North as well. Dressing for success is a really important part of being ready to give in the community and also gain some amazing experiences. So if you are in conditions where it's -40 and -50 and exposed skin is going to cause some serious damage very quickly, you can't have exposed skin. So you can see Dr. Michelle Tuma here and Genevieve Doyen, who is the clinic officer. They are prepared to hit out on the land on a snow machine to go vaccinate some dogs outside of the community. You can have a little bit of your skin exposed here and there, and you need to be warm. And then sometimes you have to pack a bathing suit so you can do a cold plunge in whatever part of the Arctic you're in, if you're there in the milder times. I don't recommend it at -40. It can be done, but if it's hovering around zero, it's worthwhile to have that experience with your teammates. One of the things you'd learn in the North is you learn about northern dogs. And most people think about northern dogs and they think about this. They think about dog teams. They think about dog sledding. They think about, dogs being together in large groups. And that's traditionally, how you would have seen dogs in the North. There's still, like, you may be lucky enough if you're working in Alaska or on Baffin Island, and some of the communities may have one or two dog teams that you get an opportunity to check over, vaccinate, and deworm. But you'll also meet a lot of solo northern dogs. So some households may just have one or two dogs that live outside year round, tied up with dog houses. You meet people that have moved to the North that have brought their dogs from the South that have a more, traditional Southern relationship with their dogs, that live in the house, spend most of their time in the house. And you never know what breeds you're going to meet. They've met small dogs, big dogs, little dogs. But the northern dogs that are meant to live outdoors, they look an awful lot like this. A lot of hair, very close to the ground. They're built for winter. And you learn a lot about the relationships that people have with their dogs. And one of the things that I've gained a huge understanding of in the North is that relationship differs from person to person, from household to household, and from community to community. And when you spend enough time in the North and you go up a few times, you start to see some, get a better understanding of the One Health scenario that can be a reality in the North. And that's how animals are integrated with people and they're integrated in the environment. Now, these interactions can be very positive. Some of these interactions can be very negative or challenging. But it's really the care of dogs starts with the care of people. They need to be cared for so they can give dogs the special care that they need. They need to be supported in knowing what dogs need, what special care they need to live happy and healthy. And we do our part as far as helping prevent, vaccine prevented diseases, deworming dogs, doing foot care, doing client education, anything that we can. But some of the problems, that we see dogs have if they're in not great body condition, or, they're not making it through the winter. Some of those things are symptomatic of some of the health issues and social issues in the communities where we work. So food insecurity has a great impact on the health of dogs. A lot of households share their food with dogs, whether it's hunted food or country food or fish or just leftovers. If that isn't there, the dogs don't get anything. Dog food is extremely expensive to buy commercial dog food in the north. Traditionally, the dogs are fed country food that can be raw, cooked. It can be leftovers from people's households. So that can really impact the health of dogs. And, there are people that live in fear of dog bites or getting hurt by dogs. So that can have an impact on people feeling safe in their communities. Also, people don't always store their food in the house. If they've had a caribou kill or something, they do a lot of meat preparation outside or store their meat outside on their porch. And if dogs are out roaming, they're not tied or they're not confined, they can really disrupt the food supply of people as well. And that makes people not appreciate having dogs in the community. So I think one of the biggest things I've gained in the North is this understanding of the One Health picture and how Vets Without Borders and the NAHI clinics are a part of it. What do you give? You get to put your skills to work, and it may not be putting them to work in the same way that you do day to day in your regular vet life. Sometimes you're working in a surgical unit in a community hall or a fire station or even a classroom. These are open clinics, so anyone is welcome to come and observe and learn or participate. That often means there's kids around, and that can be chaotic at times. But when those kids get engaged with what's going on and they ask questions and they ask how to help, they will clean off a table, they'll clean up after a dog's gone on the floor. It's really beneficial to see them get interested in what it takes to care for dogs. Sometimes you may just be in a room that has no light and you're working on somebody's desk. Might be I would say, a police station or jail in Alaska, and the table might just be desk height. And if you're as tall as me, I'm nearly 6 foot tall, you're just do surgery with your legs spread super wide and try not to take a long time because your legs get tired. So the conditions can vary from community to community where you're working, but you've always got a super supportive team. You may have different protocols around anesthetic and pain management, vaccine delivery, but all the things that are there have been proven and to be safe and effective and the right thing and the right fit for the community. So you just have to trust your gut that you're doing it well. And one of the things in the North is we try to meet the caregivers of the dogs where they're at. So we try to gain an understanding of their relationship with their dogs. You listen a lot, you hear stories about what their dogs do, what their dogs don't do, what their dogs like, what their dogs don't like. And I would say quite often we get a mix of people bringing dogs and occasionally cats, occasionally rabbits, other fuzzy things to clinics. But we do see a lot of women who are the caregivers of dogs, and they're very keen to learn how to do the best job that they can. But you have to listen about what they've got to help them figure out what that looks like. So they're very proud if they're bringing their pets in and they get a vaccine certificate, or they may take away a new tie out or a new leash or a new collar, or even a bandana. They're very proud that they've been able to come and help their pets out the best they can. I shouldn't say pets, their dogs out. It's not always a pet relationship. And sometimes you're doing house visits, sometimes you're out in the snow, sometimes you're outside of communities at cabins or on lakes, vaccinating outdoor dogs or sled dogs. And you just meet people wherever they need you to be. You just get there and you do your best. One of the things that's also important to give in the North is, being ready to teach, build capacity, any opportunity we have to engage youth, whether it's school visits, whether it's showing youth or letting them touch things when we can in the clinic, teaching lay vaccinators that are interested, or in more formal ways with training community animal health workers to have the skills and knowledge that they need to fill the gap the best they can. when Vets Without Borders is not in the community. So these are all ways that we're, giving, even hopefully, to have an impression when we're not there and into the future. And really important, one of the things you gain are connections. If you get a chance to play music with people, hear a storyteller talk about what it was like going to the lakes with their family as a youth, meet local artisans, sometimes you just have to hold a baby. You just make those connections, you do what you got to do. Working with youth in communities that are interested in animal care or animal careers. Every time you see them, every time you re-meet them, they get older and smarter and wiser and more helpful. So it can really help your community and your clinic out to get to know people. So I'd say making connections with your community members year after year is super beneficial for you. It's great that they see friendly faces that they've met before. It helps build trust and it gets people coming back. And for goodness sakes, if you're asked to a wedding or a dinner, or if you're asked to dance, you just got to dance. So I was going to say, quick video here. We recognize Dr. Michelle Suma, God, who used to work at the They got asked to jig. And I'm glad it wasn't me that got asked. I've tried jigging. I'm not quite there yet. I'm still willing to learn. I haven't given up. But yeah, it's a great opportunity just to immerse yourself in the culture, and you gain so much from that. It's a lot of fun, and just never say no to somebody. I didn't want that to play again. I want to jump to my last slide so I don't go over time. So I would say one of the other things that it is a give and gain is that you're working a lot of the times with amazing women. Many of the trips I've done up north, the trips are all women or they are mostly women. I've met women from all over Canada, from the United States, and everybody brings something to this program. And you take a lot away from it. There's a lot of knowledge sharing. There's a lot of, typically when veterinary professionals get together, a lot of, worst case scenarios and complaints about what we're all seeing and we're sick and tired of, but also a lot of joy and success, and everybody's got everybody's back. And I think working in that environment where people know why they're there, you've got a shared mission, you've got, sometimes little mini adventures you're going on. You're working with community client support representatives that you get to know that are, happy to see you again the next time. It really has been an honor and a pleasure with working with all of these women over the past few years. And I mostly hope to gain more experience and more fun as time goes on. I think every time I've gone on a NAHI clinic, I'd say this is the best team I've ever worked with. And it's not a lie. And I will say that again and again over time, because every team is amazing and they're different, but you learn so much, and you're all giving together, which makes it a really great experience. So thanks to all those wonderful women I get to work with, and I'll stop it there.
Great. Thank you so much, Trace, for sharing your experiences and the important work that's being done in Canada's northern communities. We have some questions for you, but I'm going to save them until the end of all of the presentations, and then we'll come back to the questions. So next we have Madeline Nielsen. Madeline is a program officer with VWB's VETS program and also a former VETS volunteer. She brings a background in bioveterinary science and global development with several years of experience focused on gender and rural livelihoods. In 2024, she served as a gender advisor in Kenya through VWB's Emerging Leaders program, working alongside local partners to strengthen women's participation and leadership in livestock systems. So today she's going to share reflections from that experience, including what she contributed, what she learned, and how it shaped her perspective on gender and animal health. Floor is yours, Madeline.
Thanks so much for the intro, Janine. I'm going to go ahead and share my screen. Okay. Oh, yeah, looks like it works. Perfect. Thank you so much for that presentation, Trace, as well. It was really great to hear about your experience in northern Canada, and I'm excited to hear from Kavita as well. Um, Great. So I'm here today to talk a little bit about gender mainstreaming in smallholder dairy farming and what that looks like from my own perspectives from a placement that I completed 2 years ago in Kenya through the VETS project. Personally, I think that any conversation about gender, it's really important to start with positionality. Janine gave a bit of an introduction about me and my background, but I'll also say that I grew up and I'm currently located in rural Mi'kma'ki, also known as Nova Scotia. And while I myself didn't grow up on a farm, I learned so much about livestock production by working primarily with dairy cattle, but also with beef cattle and draft horses, mainly through 4-H animal handling and showmanship competitions with lots of support from farmers in my community. I actually wanted to be a large animal vet for a very long time because of my background, and I could see through those experiences growing up how critical healthy livestock are for farmers' livelihoods and well-being. So I ended up pursuing my bachelor's in bioveterinary science and then eventually my master's degree in global development studies, where One Health was a core part of my master's research on gender dynamics in dairy farming. I also want to recognize that I'm not Kenyan and I come from a place of privilege. So any gender dynamics that I'm talking about today are from my own perspective, from an outsider perspective. And I think that insights on gender are best suited to come from local communities, which informed my facilitation approaches when I was in Kenya. So what is the VETS project? VETS stands for Volunteers Engaged in Gender Responsive Technical Solutions. It's one of VWB's projects, and this one is specifically funded by Global Affairs Canada. VETS is part of a volunteer cooperation program, so it's where volunteers can currently support our 4 partners in Ghana, Kenya, Cambodia, and Laos through capacity building approaches to ensure long-term sustainability. And the overall goal of VETS is to improve economic and social well-being, particularly for women and girls. And while all VETS volunteer placements are a little different, all placements apply practical One Health approaches. So considering the connection between human, animal, and environmental health. They also all apply a gender lens. So this allows development of gender responsive and environmentally sustainable agriculture and health practices. We have had lots of dedicated veterinarians and veterinary students as volunteers, but we've also had a wide range of placements like communications placements, monitoring and evaluation, gender, nutrition, agronomy, just to name a few. So my specific volunteer placement with VETS was in Meru, Kenya, which you can see kind of in the middle of the map of Kenya, right on the equator. VETS has 2 partners in the Central Highlands regions of Kenya. Where I was placed was Meru Dairy in the small city of Meru and Wakulima Dairy, which is in the town of Mukurweini in Nyeri County. And VETS volunteer placements in Kenya have a specific focus on capacity sharing with a focus on smallholder dairy farming, especially for women. And this is to improve livelihoods, strengthen the dairy value chain, and advance gender equality. Volunteer placements are co-created with local partners based on their priorities. So in Kenya recently, a few examples have been improved milk quality, biosecurity and mastitis prevention, calf care, animal nutrition, and gender roles on the farm. And I love this picture. Our 2 partners in Kenya for VETS are about 2.5 hours away by car, and Mount Kenya actually sits right in the middle of both of them. So you can actually see the 3 peaks from the highway on a clear day. I specifically volunteered for VETS through the Emerging Leaders Program. For veterinary, we're graduate students, and in my case, for young professionals. So the ELP offers additional guidance to this group of volunteers through support through technical advisor volunteers who are veterinarians supporting vet students through mentorship at the beginning of their placements. And it's a fantastic opportunity for young people to gain cross-cultural experience and complete a One Health placement early in their career. So we're here to talk about Give to Gain and what that looks like from a gender context today in One Health. So how does this actually connect to smallholder dairy farming in Kenya? One thing to consider is something called gender roles. So basically what gender roles are the societal determination of tasks, who completes what task, and what is more acceptable for different gender identities to complete. In dairy farming, these can vary on farm, and they can affect day-to-day production activities in different ways. So in rural Kenya, in some cases, I noticed that women were predominantly responsible for cow care and milking, for example, while it was also the norm for men to make final farm management decisions and make final decisions on finances. Gender dynamics can also shift depending on the farm in Kenya. So if women are more directly involved in cow care, but men are making final decisions about asset management and farm management, there may be a bit of a disconnect if she, for example, notices a disease that needs to be treated, and he's the one making the final decision on, first of all, calling the vet and then deciding what medication to purchase. Also, women face some additional exposures to zoonotic diseases if they're more directly involved in cow care. So this could be things like ringworm or something more serious like brucellosis in Kenya if they're more directly involved in cow care. Gender division of labor, there are also some less obvious tasks in the home that vary depending on gender. So I learned through conversations with farmers and really listening to what they had to say that cooking, cleaning, and childcare were much more commonly completed by women in rural Kenya. So these women expressed to me that they had less available time in their day due to these cultural norms. Both dairies work with small dairy cooperatives whose members elect a president, vice president, and a treasurer. And there are still predominantly men in leadership roles. So Meru Dairy actually flagged to me early in my placement that they noticed that cooperatives led by women have actually generated higher milk yields and higher quality milk. So despite a few co-ops being led by women, women still face barriers to accessing leadership roles due to cultural norms and gender roles. So overall, considering gender in dairy farming can also bring socioeconomic benefits to all levels of the dairy value chain. So based on this context, what was I doing in Kenya? The activities that I completed on my volunteer placement as a gender advisor were deeply, deeply informed by the local gender context and fully based on partner priorities, as the goal of vets isn't to tell communities what to do, but it's to listen to their own priorities and to facilitate and apply skills to have capacity sharing sessions. So in animal health training sessions, due to cultural perceptions about gender, our partner organization informed me that if we were to offer a standalone gender training session, it may not be super well attended. So we integrated gender throughout animal health training sessions with the help of other volunteers. So we talked about gender roles, connecting them to animal health, how women's cooperative leadership can benefit entire families and communities as well. We had training sessions on gender with Meru Dairy staff on a few different topics that I've listed here. And we also had training sessions with extension officers. So these are staff from Meru Dairy who are assigned to support farmers with mentorship on production management, so things like feed and nutrition, housing, and animal breeding, while vets typically only respond to and treat diseases in this specific context. So with the extension officers, we had training on gender dynamics in dairy farming and how to approach their work in a way that supports both men and women, as women can often be left out of the conversation due to sociocultural norms. Community One Health Champions had a very similar training. So this is a group of farmers who support their peers with advice and community support to have a sustainable model to improve their animal production systems. And informal conversations about gender. Similar to what Trace was saying, actually, I think connection building and community building is so important in this work. So this was a key component of my placement and really informed how I facilitated activities in a culturally informed and respectful manner. I also added men and boys engagement. Some folks think anywhere in the world that gender is only for women and girls to consider, but that's far from the truth. Gender is for everyone to consider, and having conversations about gender equality, it's super, super important that we have men and boys engaged as allies. So I really enjoyed that part of my placement as well. So none of this would have been possible without insights from local communities. I was only in Kenya for 3 months, but reducing gender inequalities can take literal generations. So I want to talk about Doreen, Doris, and Betty. These are 3 extension officers, 2 of which are in the photo here, who I met during my placement. Extension, it's not just a career path in Kenya, it's all throughout the world, and it's predominantly men that are involved in this field. And in this case, 3 out of 13 employed by Meru Dairy when I was there were women. So based on their own lived experiences as women, these three women I talked to had some additional insights to offer on how gender and animal health intersect based on their own lived experiences. So, on the way to a farm visit, Betty shared that women often face additional barriers to harvesting feed for their cows during the dry season, as it's less plentiful and even less so with climate change, which increases droughts. They have to walk further distances to source feed while also having less time available to do so due to gender roles in the home. So she recommended to farmers having silage production, which is just fermented feed, allowing for safe and more sustainable long-term storage if extension officers can demonstrate how to prepare it properly. So I use this example quite a bit based on her own lived experience and her own local knowledge throughout my placement with extension staff. So, what did I gain when I was giving my time during this placement? This placement has impacted me in so many different ways. It's really helped with, for example, my cross-cultural communication skills. There may be communications differences in different countries, and in Kenya, I noticed it was a bit more indirect. So I really learned how to navigate that and apply that to my future work in international cooperation. I was also at the beginning of my placement, I was quite nervous to have conversations about gender, especially with men, in a different cultural context, because my main concern was not to impose a specific agenda and to really respect local priorities. So this placement really improved my facilitation skills for conversations about gender that challenge perceptions but remain culturally informed. And I want to add as well, farmers are incredible people, no matter where you are in the world, and have a fantastic sense of humor no matter where you are. So I learned a lot about small scale dairy farming from them, and they very kindly welcomed us onto their farms. And I want to end with saying if you're interested in becoming a vets volunteer, we do have placements available, and I highly encourage you to consider. You certainly don't have to be a gender expert because we do have amazing supports available for that. Our only requirement is just from our funder that you have to be a Canadian citizen or have permanent residency, but happy to answer any questions about that as well. And I just want to say Iwega Mono, which is Kimero for thank you, and Asanteni Sana in Swahili.
Thank you so much, Madeline, for highlighting so much, but also that change isn't just technical. It really is contextual. It's about relationships, communication, and shifting roles. Our final speaker is Kavita Misra. Kavita is VWB's gender advisor and an international development professional with over a decade of experience advancing gender equality, health, and education initiatives across Asia and Africa. Her work focuses on how gender dynamics shape access to knowledge, livelihoods, and health systems, and how programs can better support inclusive leadership at the community level. Kavita also previously served as a VWB volunteer in Vietnam, bringing both field and program experience to her role. Today, she's going to share with us some reflections from a recent visit to our Cohers program in Senegal, where she is engaged with local One Health teams and women livestock keepers and observed how knowledge shared at the community level is translating into changes within households and communities. Kavita, over to you.
Thank you, Janine, and thanks, Madeline and Trace, for those amazing presentations and sharing your experiences in Kenya and northern communities, respectively. Let me just share my screen here. All right, so we've heard a bit about how knowledge travels within communities and across countries as well. And I really want to focus here on what happens when local volunteers lead change and what happens at the community level and also at the household level. So when we look at livestock and primary livestock caregivers, we see primarily are women. They're the ones feeding animals, preparing food, detecting any animal health concerns. However, there's a gap, and that gap seems to be that they have limited access to formal training or information with regards to animal health. So this results in greater health risks, and this gap results in limited access to knowledge as well as decision-making power. And so what happens when this gap is filled, and what does that look like at the household level is what I want to touch on today. So what is COHERS? And Janine mentioned that I'll be speaking about my experience with the COHERS program. And so this is Community One Health Empowerment in Rwanda and Senegal. It's the program that's built on the idea that the most effective solutions come from within the community, and it brings together community animal health workers, community health workers, wash and sanitation workers, and they work together as local volunteers to be able to deliver information to the communities in a practical way that can be applied to day-to-day lives. And they connect these their knowledge and experience on animal, human, and environmental health, as well as create spaces for women to lead within their communities as well. So what is the role of the local volunteers within these One Health teams? So as I mentioned, they take this information, they not only translate and provide information to the community, but they provide it in a way that is applicable, that is relevant to the communities from which they come from. And this results in local action, and it results in a deeper shift of not only who has access to knowledge, but also who holds the knowledge and who holds influence, both within the household as well as the community. They're trusted community members, and as a result of this approach, we see that it results in more sustainable change. So I'd like to share a story from Senegal specifically when I was there. I met a woman who, she's not only a participant in the activities of the COHERS programs, but she's also a One Health team member herself. She shared that through her role, she gained knowledge about zoonotic diseases and animal health, but more importantly, she gained something that we can think of as technical agency. She became recognized within her household as a risk manager, someone who understands how to protect their animals and also their health. And that recognition led to real changes within the household and had a ripple effect of change within the community as well. So she shared with me that before the project, we didn't share and communicate information. But after the project, I share a lot with my husband because I receive a lot of information on zoonotic diseases. And she shared that they used to kill and eat all the sick animals. But now when they buy a goat, for instance, they call a vet or animal health worker first and have the animal examined before putting it with the rest of the herd. She also mentioned that now I can she can have a conversation with her husband, and he doesn't get mad when he brings in meat and she questions where it came from and how they should approach the situation. Her husband also noticed that we improve our communication and exchange a lot about taking care of animals. And so seeing the shift, when her husband reflected on this shift, he said how because of these improved communication methods and how they speak more about animal health, it resulted in more shared decision making. So they make more decisions about their animals, about finances, and they're able to have more open conversations about some of these topics as well. And because of this, she became a recognized expert both within her household and within the community. And what we saw across the households, as I was speaking to them about this change, we also saw that more men were involved in what would traditionally be identified as tasks for the women. So we saw more men supporting women with fetching firewood, for instance, or one man shared that he cleans the yard now because he realized how much work his wife was responsible for within the household, and also that now that she's more involved in animal health care, he thought this would be a good way to support and divide and share roles and responsibilities. So what changed? We see safer animal health practices in this situation. We saw that they don't consume a sick animal anymore. They actually have access to community animal health workers or veterinarians in order to understand what the best next practices are. And so this is a direct One Health outcome because they have better animal health as well as human health, and it's a biosecurity win. There's better communication within the household. There's more information sharing that we saw across the households that we spoke to, including the one that I shared here. And it was a clear example of how women, when they have access to knowledge and have more space to share that information, they're also being recognized leaders, becoming recognized leaders within the household and the community as well. And there was a more sharing role. There's a more shared responsibilities and roles within the household among the different members of the family. And what was really interesting also was there was more discussion, not only around the different roles and responsibilities that men and women were responsible for within the household, but also the different risks when it comes to the different roles that different family members play as well. So certain families shared, actually, we never considered the risks that children might have. And so one family shared, the young girls in the household actually are responsible for, they take the discarded meat, they practice cutting, prepping food, etc. And now, as a result of this information, mothers, when they share those tasks with the younger females in the household, they consider more what risks they might be at, the younger women might be at as well, and have more discussions around those. And so overall, the family shared, there's better some more support amongst the family. So when looking at give to gain, what are we saying? Local volunteers are giving their time, their leadership, and they're gaining respect and influence within their communities. They're trusted members of the communities and resulting in sustainable change. Women are gaining knowledge and decision-making power within the households and becoming recognized leaders and experts within their communities. Households, they're gaining health when it comes to animal health, human health, water and sanitation practices. There's a shift in behavior and more better health outcomes for the household as a whole. Communities are gaining role models. They're gaining examples of what change could look like in a sustainable manner. So this is where the local volunteers' role is really critical and how the One Health teams really result in that sustainable shift and change within the communities. So when looking at key takeaways, what is it that we see? When women have access to knowledge, they don't just change practices. There's transformation within the household. When we invest in local volunteers, as we see through the One Health teams, we're building systems that actually last. And this lasting change happens not just because knowledge is shared, but also because it's shared by someone who's trusted and in a manner that is used in everyday life and with an understanding of the lived realities and the context within which these One Health teams are working. So overall, this is an example of how just the importance of local volunteers and how VWB really encourages that local volunteership within communities that we work in.
Thank you so much, Kavita. It's really great to see that even some of the small activities we are doing, because social behavioral change happens over a long period of time, but they're leaving system strengthening components that hopefully will carry on beyond our smaller programs. So thank you so much for that. I see all of our speakers have come back on screen, so that's great. We do have quite a few questions here in the Q&A box, so really happy to see participants engaging. Please continue to put your questions in there, and we will we'll get through as many as we possibly can in the remaining time. The first two questions are for Trace. So the first question is around remote communities where services are intermittent. How do you think about balancing short-term veterinary interventions with building longer-term local capacity?
Yeah, well, I think it's important to balance the two. I think Vets Without Borders, one of the things I've really enjoyed volunteering with them is their commitment with partnerships that are year over year or twice a year in some communities. And I think that's super important to actually make a change. Without that, and even when you are on the ground just once or twice a year, that is part of the solution for providing access to care. But the other term is building that long-term local capacity. And I see that happening in a few ways with Vets Without Borders. One, it starts with the youth. So you're building an understanding and an interest in animal care, animal science, health sciences, helping youth have a better relationship or better understanding of the animals that they live with or that are in their environment. And the importance of taking care of all those things. So that starts, you plant that seed and, it's really great to go back to communities and, the next year the kids remember what your favorite animal was, or, they fully know how to avoid a dog bite. So you see that really sticking in there. And I think that's where it really starts is getting the young kids involved. But then the other piece is, working with people in the community, adults, teenagers, young adults, who are interested in getting some hand-on experience or a better understanding of what they can do to take better care of their dogs, to do the best they can with what they've got. And you have to listen a lot and understand, because it really is an exchange of knowledge. It's not going one way. And everything that you can do to promote responsible dog ownership, to prevent dogs from roaming or getting into trouble, potentially getting injured or hurt, or potentially causing damage or injuring and hurting others. Anything that you can do to support that work in communities is great. And then I think on the deeper level, what Vets Without Borders is doing with exploring community animal health worker model, from the years and years and years they have of learning from Southern programs where community members are trained and educated on providing some animal care when there aren't vets or vet professionals in the community, is super important. It's a big gap. I live in a rural area and people are mad that there's no in-person on call during the weeknights. Up north, you can understand what it might feel like to be a community member and have an animal that is sick or injured or just isn't doing right, and you've got nobody to reach out to locally. So I think the community animal health worker training, over time, it's fresh. It's just come out of a pilot phase. And it'll be interesting to see what's learned and how that program works to help people. The other piece in that is telehealth, where at least you've got a voice on the end of a line, and whether community animal health workers are the bridge to, do a physical exam, get some vitals off a dog, help ask the right questions, be able to provide what they can help people with. I think it's really important in the long term. And ultimately, would be great to have people who grew up in the North taking over from all of us Southern vets that travel up there and providing the care that is needed for dogs and their people and their communities. And that would be the ultimate dream, I think.
Great. Thanks so much for that, Trace. The next question is really about trust. It's indicated for northern communities, but really trust building happens no matter what community we're working in or what country we're going to. And I think Madeline alluded to that as well, as co-creation and acknowledging that you don't come from that culture or community, and seeing where we can be allies. So yeah, maybe, I don't know, Madeline, if you want to express a little bit more about that trust building component of the work we do.
Sure, yeah. I think this ties in really well to what Kavita and Trace were saying as well. Talking about relationship building, I think, is so, so important. I think international development has a past of imposing and saying what needs to be done, especially to communities in the global south and to indigenous communities. So I think it can't happen sustainably without trust building. And when we're talking about give to gain, just going back to that theme, I really like considering reciprocal knowledge sharing. So when we're talking about, gaining trust and then being able to have a conversation about maybe there's this gender norm that we can reconsider or talk about or learn more about. I'm also learning a lot as a volunteer as well from the communities themselves. So I think international cooperation work can't happen without long-term sustainable partnerships. Even if a volunteer placement is super short, mine was only for 3 months, the partnerships are still continuing. And I think, as Trace was saying, especially really getting to know people as humans and not just thinking of it as kind of a business mindset is really, really important. Learning about their family and their kids and all of that is a good place to start.
No, great. Thanks for that. This kind of leads me to kind of an expansion question on this, because for those of us who've worked in international development, VWB is quite unique because we have not only international programs, we also have domestic programs here in Canada and in the US, in Alaska. So I'm really interested, Trace, you've got experience with both. Is trust building different when you're working domestically here in Canada versus internationally, or is it the same no matter where you go?
I think there are some cross-cutting ideas about relationship building and trust, no matter where you're working. I'd say one of the interesting things working in Canada's North versus volunteering elsewhere, and I hope if you ever go back to Maros, I had everybody for me. I loved it up there. That in when you're in Kenya, you go places where colonization didn't actually happen. Like Meru is one of those places. But then your other community with the other dairy, there's definitely like colonial touch there. In Canada, like I am of the settler population, and so I am seen as the colonizer. So that can be like historically, it's very different working around the world than where you're working at home, and you're working in the spirit of truth and reconciliation, and it's more personal. So I think that's one of the things. It can also be really important for trust building as well, where even if it's not the same people over and over again, if they know it's Vets Without Borders and they trust the organization and they trust that we're doing things in a reciprocal way or a knowledge sharing way and a respectful way, that's also valid across all experiences and across all countries. And yeah, and I would say that in a lot of places that I've volunteered in Africa and Asia, there have been vets around or extension officers or community animal health workers, probably longer than we've had people in community in the north. So even though it's one of the things I wanted to do ever since I got involved with Vets Without Borders and finally got the chance, it's still a very fresh young program, and it's really done a great job for what it's doing. But people aren't used to having veterinary care, and people have lived for thousands and thousands of years without it. So there's still a lot of trust building. And one year you go, you may not see somebody and you'll see a dog. The next year you may talk them into maybe just deworming their dog because they've seen the worms and they know that it costs more to feed them, or they get skinny over the winter, or they might not make it. And then maybe the next year they'll come in for a vaccine, and then could be a year or two there they decide that what, maybe I will like have a spay or neuter because this might help me and it might help my dog. And but every one of those steps is so important in that trust building, and making sure that dogs are well cared for while you're there, and the people are well cared for while you're there. All of those things over time, I think we'll be seeing that same trust that has been there for a longer time in a lot of different countries.
No, thanks for that. That's great. And yeah, continuing on the theme of trust, Kavita, you shared a story about the intra-household dynamic, and there's a lot of trust that needs to be built within those relationships culturally as well to shift some of the thinking. So what role does trust play within the community amongst community members in different social and cultural contexts?
Yeah, so when we're looking at trust and looking at the importance of that intra-household dynamic, sometimes we focus more on the visible outcomes, things like improved animal care. We look at safer handling of sick animals, or are they calling a vet and accessing community animal health workers? And those outcomes are absolutely important. But what I found really powerful, as I shared in the story, is that those technical changes were made possible because of something that shifted in that household first, and because of that communication and trust that was built within that household. So when women have access to knowledge and are able to discuss that knowledge openly and are able to be trusted, recognized as trusted experts within the household, they're much more likely to influence decisions that affect animal health as well as human health. And so for me, that trust and that improved communication isn't separate from the health outcomes that we want to see, but it's also often what makes those outcomes possible and sustainable.
Oh, great. Thanks so much. Madeline, there's a question here around the acknowledgement that our vets program at VWB brings in a wide range of volunteer expertise. And the question is, where do you think external technical knowledge adds the most value, and where does it need to step back and adapt?
Yeah, that's a great question. I think I'm going to give a bit of a complicated answer, not super straightforward, but I think it's case by case. I think there's really fantastic knowledge that comes from volunteers. I can speak more to the case of vets, really fantastic vets volunteers who have so much knowledge to give on their placements in different countries, but also so much to learn. For example, I can think of, I mentioned mastitis as a big challenge in Kenya. So, talking about California mastitis tests, how to detect mastitis, whether it's clinical, where you can see symptoms on the udder, or if it's subclinical and it's just kind of affecting your milk quality. That could be an external tool that's brought in. And I think it would depend on what, first of all, if it's well received by the community, but also, for example, if it's cost effective. So I think the biggest takeaway here is there's lots of fantastic knowledge that comes in from volunteers, but it's super context specific if it's going to be applicable. So reiterating, listening and learning from local communities to see if it's something that works for them, to have that reciprocal knowledge exchange, I think is how to go about it.
Um, I'm wondering with time whether we have enough time for maybe one more question across the board here. So for all of the panelists, what is one barrier that still feels persistent? Something that isn't easily solved when it comes to supporting women in this type of work. And maybe we'll start with you, Kavita.
Thanks, Janine. Great question. So I think a big barrier for me, what I see is that it's often women are often already doing the work when we're looking at livestock management, for instance, as in the case I shared, but they're not always recognized as the expert or the decision maker or the risk manager. And so they may be caring for the animals every day, but they still have less access to information, to knowledge, and opportunities to influence household or community decisions, whether it's within the One Health teams and their role within the One Health teams compared to their male counterparts, or within the households and the communities and the farming families that we're working with. And so the issue isn't about participation, it's about whether women have that visibility and that support and that influence to lead. And so for the local volunteer models, I think that's where they play an important role because they can help create those spaces um, so that women can not just contribute, but be seen and valued. But this is an ongoing barrier that recognition of women as expert and decision makers.
Great. Thank you, Kavita. I'll hand it over to Trace next.
Sure. I think I'm going to just kind of touch on the community animal health worker model here in the north. In the the southern hemisphere or the global south, community animal health workers generally are working with livestock and with the goal of like helping household incomes and through the health of animals. And they have opportunities to generate revenue. What I find one of the issues in trying to make a community animal health worker program in the north where in communities where Vets Without Borders has worked, the clinical work that we do is provided at no cost to the dog owners or the animal owners. There's like a shared cost that the communities contribute, and then donations and support from Vets Without Borders and all of the partners. I cannot even list them. Well, we've definitely run out of time, but it takes a lot for these clinics to happen. And but people aren't used to paying out of pocket for anything to do with veterinary care. So I think one of the barriers for sustaining the community animal health worker will be around not just recognition of the value that the community animal health workers bring to the community, and especially the extra time when women we're still doing this. We still have the like major burden of household care, child care, elder care, all of the things that take our time, energy, and attention. And retaining women, we have to make it valuable for them. And I think over time, making sure that people are compensated for the work that they do somehow, whether that comes like adopt a community animal health worker donation program, something along those lines. I think that's going to be so important to break that barrier and help deal with attrition from the program.
Great. Thanks so much, Trace. Madeline, any thoughts on that?
Yeah, great point, both of you. Thanks for sharing. I think a challenge is access to decision making in animal health care. This certainly varies culture to culture, context to context. But one thing I touched on when I talked about vets and having conversations about gender was men and boys engagement. So I think it's not going to fix everything overnight. As I said, gender roles and gender transformative change can quite literally take generations to change at all. But I think easy first steps like getting men and boys involved in the conversation and having peer-to-peer approaches like community animal health workers, for example, and peer-to-peer learning where you can demonstrate that it is possible to include all gender identities in these conversations and to move forward on animal health decision making from there.
Great, thanks so much. Unfortunately, we've run out of time to ask more questions. I just really want to extend a sincere thank you to our panelists, some fantastic women leaders who are uplifting other women leaders in different communities. So thank you for sharing your knowledge and your friendship with different women around the world. Trace, Madeline, and Kavita, what we've heard today is that change doesn't happen in isolation. It really happens through shared knowledge and mutual learning and the leadership of women within their communities. Whether in Northern Canada or East Africa or West Africa, the principle is the same. When women are supported with the tools, knowledge, and opportunities to lead, the impact extends far beyond the individual to households, to communities, and to entire systems. That is the essence of Give to Gain. Please note that a recording of today's webinar will be available soon. Please check vwb.org for updates. To learn more about VWB's programs, volunteer opportunities, or partnerships, visit our website or follow us on social media. Thank you again, everyone, for joining today's discussion, and have a great evening, morning, afternoon. Bye-bye.